Right, Sandeep, we'll be right back with you. Let's just quickly go across to Mr. Arun Sawhney, CEO at MD at Ranbaxy. He joins us on the show. Arun, hi, morning. There has been significant damage to the company's reputation after your $500 million settlement and pleading guilty. What kind of damage control measures have you had to take?
You know, Ranbaxy is the #1 pharmaceutical company from India, and we have inherently great strengths. We have invested more than $300 million in upgrading our facilities, bringing in the best consultants, imparting skill sets, and developing training programs. All these measures will go into building the strength of Ranbaxy for future. We have very ambitious growth plans based on the investments that we are making in our manufacturing setup, based on the portfolio of products that we are developing in our R&D pipeline, based on the markets and therapeutic areas that we are focusing, and not to forget the team that we have that will execute on all these plans.
Right. Arun, some pharmacies like Apollo have already stopped sale of Ranbaxy drugs. How worried are you about other hospital and pharmacies following the suit, and how do you plan to convince them about the quality of your drugs?
By and large, all hospitals in India are patronizing Ranbaxy medicines. They are prescribing Ranbaxy medicines. I respect internal processes of each and every hospital, just like we would respect internal processes of any one of our customers. We will continue to provide and support them with information relating to Ranbaxy medicines. And I reiterate, we are operating from our paradigm of quality and patients first. This will repose greater faith in Ranbaxy medicines.
So it isn't just regulatory hurdles that pose a problem. There is litigation in the Supreme Court as well. Some serious charges have been leveled against the company. How seriously can that damage sales when it comes to India?
I have not seen the court documents. Once I get the court documents of PIL, I will then be in a position to comment on that.
Now, Arun, you've spent about $300 million on upgradation of your facilities. $500 million penalty has already gone out. High spend on remedial measures is also putting pressure on your margins. How much more will you have to spend on building the brand once again?
When I say that we operate from paradigm of quality and patients first, there is also an underlying commitment to keep making investments that allow us to live with this paradigm. We will continue to make investments that will be in line with our growth plans. We will continue to invest in R&D. We will continue to invest in our manufacturing. We will continue to invest in our growth plans in business. To grow the business organically or inorganically, we will continue on our growth plans and keep investing on them.
So can you quantify the impact on the margin for the current fiscal?
We have given our guidance for the current fiscal that we will close the fiscal with 120 billion rupees.
Right. Now, there has been a view that many of the charges levied by the US FDA are not relevant to India. Do you subscribe to that view? And if so, how can standards of quality be different for Indians and Americans? Isn't that slightly unfair?
Okay, in relation to the US FDA and DOJ, let me clarify that these are two separate agencies. We settled with DOJ, and with the USA we signed the consent decree. There are certain expressions that are used in the USA that could be differently understood in India as they would be differently understood in other parts of the world. Say, for example, the word adulterated. A pharmaceutical company is expected to be operating in CGMP conditions. CGMP stands for Current Good Manufacturing Practices. In case of Ranbaxy, the delayed testing of stability samples was considered to be a non-GMP activity. The data that Ranbaxy generated from the delayed testing of stability samples was a non-CGMP data. The drugs that were put on the market in the US based on this data were described as adulterated. Did that make the Ranbaxy drugs spurious or substandard or contaminated? The clear answer is no. In fact, the US FDA had advised patients in the US to continue taking Ranbaxy drugs because they didn't find anything wrong with the quality of the drugs. In fact, I would like to dwell a little on quality here also. What is quality? Quality is not about good machines. Quality is not about only products. Quality is also about the way the company conducts itself. Say, for example, a company like Ranbaxy, which has very high standards of quality.
So there is a probe that has been initiated in India as well. Have any of your units been investigated in the last few weeks? Have you had to give any written or oral submissions as well to the government agencies or authorities?
To my knowledge, there has been no probe instituted against Ranbaxy.
But you have spoken with the government authorities. What has been their reaction?
We have been meeting all the stakeholders, including the government. We have offered clarifications on our situation. We respect and comply to all the government regulations. We will continue to operate from our paradigm of quality and patients first, and we will continue to comply to all the government regulations, not only in India, but in all the countries where we operate.
Right, so what has been the impact of this controversy on your financials? Will you have to take some kind of a write-off amount from the goodwill, and which will impact your book value and which will also hit your balance sheet?
We had already taken a knock in 2011, and there will be no further financial implication in 2013. We operated very well ahead of our plans in 2012. We are growing as per our plan in 2013, and we will continue with our growth plans into the future, either organically or inorganically, with all the exciting products that we have in our R&D and the investments that we are making in our manufacturing infrastructure.
So how do you see this affecting your future approvals in the key export markets like US as well as Europe?
We are continuing to make aggressive submissions all over the world as we did in the past. We expect the exciting products that we have in our R&D portfolio will get approvals and will constitute a part of our future business in the therapeutic areas, in the markets where we wish to operate in the future.
Well, in a sharp reaction, Malvinder Singh has said that Daiichi Sankyo has not managed Ranbaxy well, and the present management is responsible for the fall of Ranbaxy from its high days of glory. What would you like to say to that?
On matters for Daiichi to comment, I will leave that for Daiichi Sankyo to comment.
But you are the current management. Do you think you have managed the company well?
I can talk for Ranbaxy. I think Ranbaxy is a company that operates from very high standards of professionalism and integrity that all our stakeholders like doctors, regulators, patients, investors expect from us.
So if you do believe that information was knowingly concealed, then will Ranbaxy look at moving court against the former promoters?
I would let this be answered by Daiichi Sankyo.
But it isn't just about Ranbaxy, but many other Indian drug makers have been seen under the US FDA scanner. Is there a possibility of the industry now taking up combined action to negotiate, given the growing global anxiety about drugs manufactured in India?
Yeah, I recognize that there have been severe debates in the recent past. Responsible companies such as Ranbaxy have earned India the reputation of being pharmacy to the world. I think, and I sincerely believe, that these companies, because of their very high standards of operation, will continue to build the credibility of India as pharmacy to the world. I see no reason why we should feel threatened of being and remaining pharmacy to the world.
Okay, Arun, good chatting with you. Appreciate you taking the time out and joining us today on ETNOW. That's the view coming in from Ranbaxy. Quick break. When we come back, bring on board Chandresh Nigam, Head Investments at Axis AMC.